So, just want to say thank you so much for being here with us. And We are going to have one more guest join us here whenever she's able to. But this is actually my first Facebook Live virtual conversation with her. And I'm really excited about this. I'm really excited to be talking about retiree issues that are important to you guys and other people as well in our community. And it's also an opportunity for not just for me to engage, um, but it's also an opportunity for me to listen. I've always said since day one when I was first elected to the city council in 2013 that I don't know everything, but I have ears, and my goal is to listen and to learn and to act together in partnership with the people. And so I'm really excited to be having this conversation with you guys. Yes, I am kind of stalling right now because I see Kathy is joining us here. And so I think she is connecting to audio. So that's that. And so we'll start introductions in just a mere second. Um, there you go. I love technology. It's fun. Technology is fun. Um, so we'll just
Maybe not for some of us older people. We're still learning what's going on, like me. I wound up running a webinar today at work, and I had never done it before, and didn't know I was going to do it. But you can teach an old dog new tricks. Yeah.
Yeah, I can imagine it's challenging. So Kathy, welcome. You're on mute, just so you know.
I'm unmuting, that's right. Thank you. Hi, everyone.
Hello.
Hello.
If Kathy looks familiar to you guys, it's because she was the best ever executive assistant in the mayor's office. And so
thank you, Martin.
You're absolutely welcome, Kathy. And so she's become a good friend of mine, and I just love having her be a part of this campaign in one way or another. There's always a spot for everybody. And so I think I'm going to go ahead and just kind of introduce our friends here. And so we'll just go through that again. Very, very pleased to have council member of the city of Milton, Miss Susan Johnson.
Thank you.
I don't know if you want to wave or not for our audience on. And then we have the best deputy mayor ever, former deputy mayor, and that's Miss Hope Elder. I don't know if you want to wave as well, Hope, or not. But yeah, that's funny, Hope. And so she was our second deputy mayor in the city of Federal Way when we were first becoming a city. So very pleased to have Hope be a part of this. Also, we have Kevin Keene. I don't know if you want to wave or not, but there you go. Kevin is a dear friend of the family, my family, and a valuable member of our community, of course. And we'll also mention what Hope and Kevin are part of. And then we have the one and only Mr. Jerry Knutzen, who's a very much part of the Historical Society and many other organizations, and has done a lot to leave a footprint in Federal Way. So thank you for that, Jerry. And then we have Mr. Rajiv Nagaich, who is just an amazing friend, a business owner right here in Federal Way, specializing in elder law. And hopefully I got that right. Yep, awesome. And then, of course, people will see that Maylene Sproger is a part of this. She is a good friend and is my campaign manager, but more importantly, is a good friend of mine as well. So that's the lineup, and just thank you so much for joining us. Kathy, I'll just give it off to you to kind of start off, and we'll just kind of start the conversation. We're hoping to end at about an hour from now, 7:17. Or 7:15, whatever time is best for everybody, or before. But my goal is just to have a conversation, to learn, to engage on the issues that are really impacting our retiree community here. So, Kathy, I'll give it to you.
That's great. Thank you so much, Councilmember Moore. And that's a great introduction to everyone. Welcome, everyone. I'm glad that we're able to spend a few minutes together just to, talk about issues that are facing our community. And one of the things that Martin is trying to do is to tap into the different segments of our community and, hear what their experiences are, which obviously can be very different from one another. And so, this is another great opportunity. He spoke with parents and students previously. So, this is just another opportunity to hear from you and to get an idea of some of the things that are concerns for you or interests that you might have. And so we'll just kind of go from there. So why don't we jump in? Maybe Hope, can you tell us a little bit about some of your experiences? And I know that you're a part of the Federal Way Senior Commission as well. Is that right?
I am.
Yeah.
I am.
So, and I know that Martin, several years ago had been, discussing the idea of a senior commission, and, finally it was brought to fruition, which is wonderful. And I've been hearing great things about it. So everyone's really excited. Why don't you tell us a little bit about the work that's going on there and the perspective of retirees within our community in the 30th district and why that's important?
Well, I'm not a retiree, so that I'll have to just keep myself here.
Excellent.
Actually, I probably have an awful lot of fun at this age, simply because I do get myself into a lot of jams, and I always have friends who help get me out. But I think the Senior Commission is one of the more fun things because they actually get things done. I was making a comment that when I saw how many people there are going to be on this commission, I thought, oh, nuts, we'll never get anything done. And instead, in less than a year, we put together a pamphlet that shows people where there's free things available to them. I mean, one of the examples is if you have a wheelchair and you can't get in your home, one of the unions will come and build a ramp so that you can get your wheelchair in the house, free of charge. Now, they've done this for a lot of years. People don't know about it. And people that don't have the money to get a job like this done need to be told it's available. They're there for you, so let's help you find it. And they've done a really good job of putting this pamphlet together, and they're getting it passed out. It's going to take a while, but I'm really quite proud of what they've been able to do. And they've got some great ideas. We're all so diversified that everybody has a different idea, but you put it all together and we can get things done.
Oh, that's great. That's great. And that's so good to hear that, like you said, it's not just a meeting for the sake of a meeting, right? There's actually something happening and there's a benefit coming out. So that's great. And if you see Martin looking down at any time during our conversation here, he's not disconnecting from you. He's actually taking notes. So there's his notepad. That's great. So maybe Hope, talk a little bit about, and you did a little bit allude to some of that, some of the unique challenges that might face, folks in our community that might be considered seniors or retirees or what have you.
Well, I have an antique business that I've had for 25 years, and every day in the last 3-4 months, I've had at least 2 phone calls with people saying, I never thought I'd say these words, but I have such and such, which is in our family heirloom, and I have to sell it. And at first I thought, this is kind of strange. No, it's not strange. One of the ladies called me just a week ago and said, I have my great-grandmother's sewing machine that I thought I was going to hold on to and give it to my own kids. I can't. I need the money. It's either that or we don't have groceries. Wow. And that just breaks your heart to think in this nation we have people that have to give up something that means so much to them to put food on the table. I mean, this is just insane. But, and I also know of grandparents that are raising their grandchildren that are doing it not through the court system. They're just doing it because they're their grandkids. They have little money because they're raising grandkids on Social Security. And that doesn't go very far. And this has just hit really hard for a lot of people that I know. And I've been kind of surprised at how many people are so sad because they've lost the faith of what this country can do, what our cities can do, and they don't know where to turn. And that's why this booklet that the Senior Commission put out came right at the right time, because they're saying, we've got people that'll help.
Wow, that's great. Wonderful. Thank you for sharing that. And Susan, what could you add to that from your perspective as a in public office at this time? What are you seeing in your community, and what types of things do you think would be beneficial to try to help some of these folks?
In the city of Milton, we have only a Department of Senior Services, and we actually don't have an active group. We used to work with a nonprofit that was a senior group that ran our meal programs. Now we have what we're doing now is providing a food service every Tuesday and Thursday that people drive up because of COVID. We cannot do any activities within our Milton Activity Center. I still talk to a lot of the seniors, by phone, or I send a note, and some are feeling it's that isolation, because what we have to think about, there are a lot of seniors that have no family. They're by themselves. And that concerns me for those people, because the system is already overburdened of the people who keep track of people, help people financially. Is how do you really get that connection to people that are isolated in a 1-room, 2-room apartment in the city or an older home? And we work with another nonprofit called the Old Coots, and they do a lot of stuff. And our other senior group, they did a fundraiser recently at Alder Ridge to raise money. So there's activities and nonprofits out there doing the work that right now the city is trying to develop. Where are we going now? Once we get out of COVID, what can we do to provide the services back at the city at this point? So the nonprofits are stepping up and doing some activity.
That's great. And I think that's a really good point as well, that again, going back to that concept of community, I think as sitting in roles as, public servants, we can uniquely sort of weave together this tapestry, or try to bring together resources of people who might even be able to do more than what we can in government, right? And we can kind of bring people together.
Yes.
That's wonderful. Thanks so much.
My concern, I don't know if I can follow up on this on dealing with seniors, but when we look at adult family homes and in COVID and stuff, that people can't get in to see their families, but then the recent law that was approved that was allowing adult family homes to go from 6 to go up to 7 or 8 people in a home. And we need these homes. We actually need more of these homes, because I think sometimes, in most cases, the people are treated more family oriented than being in a senior retirement home. But does the level of care differ when you raise the number of people in a house? And I think it's an economic thing versus a best thing for seniors, that we're allowing businesses to bring in more people into a home to take care of them because it's a financial situation, rather than going out and get another person to apply and get another house to put 6 people in versus 8. And the rules, you have 2 people in a room, 3 people in a room. What's happening in COVID in these homes? A lot of them, they vary. Some are very number 10, some are number 2. It's just like the retirement homes. Some are 10, some are 2. So that's been a concern. And we see the growth here in Milton for the adult family homes in Milton.
Mm. Mm.
And with COVID, it's just a different dynamic of even trying to think this year.
Right.
Yeah, that's a great perspective legislatively, I guess, as well, as to kind of think about the impacts of some of those things and weighing out economics versus, you know, health needs. And certainly with COVID, it's kind of spun everything on its heel. And I think, you know, kind of going along with that, I think that is where it's important to kind of keep that level perspective. Like you mentioned, let's keep everyone in mind and try to do what's best for everyone in that. So that's great. Thank you. You know, Kevin, what can you add as far as a perspective to, you know, what are you seeing or hearing, or what are you experiencing, maybe particularly during this time, the last, you know, 8 months that have been really, you know, extra challenging for a lot of people. But what do you think the retiree community in particular, what challenges might they be facing?
Well, I have three things to talk about that I'm writing down. My own background, this is the fourth commission I've been on for Federal Way. So I spent about 10 years with Human Services, which was great. And then I did planning for a while and ethics too. So
that's great. That's great.
And I was on with, talk about adult family. I was on, about 10 years for a group called LARSH, which has developmentally disabled out in the Puyallup area. And they're 4 homes. I'm still involved in that on some of the boards there. So three things that I'm thinking is, I think, piggyback a little bit on, I think what Hope said, what's going on now, isolation. By the way, I work full time too at Boeing. So you know,
you're not a retiree then, are you? Not yet.
No, my dad lived to be 100 and he went to the office till he was 97. So I think that's my excuse to, but I'm getting towards the end. Number one, isolation. I think in this time, people are getting isolated. And I wonder, I'm a mental health counselor, so that's really a concern of the people who, you know, are isolated and already, you know, maybe Hope talked about the, you know, perhaps the poverty and the finances, as Susan did. But the isolation that's going on, I mean, we're all isolated. There's a lot of ways, I think, you know, so, and I certainly personally miss, you know, the interaction. So the other two things I wrote down and in connection with the isolation is on the commission, the Aging Commission Senior, we have a community center, but it's not really, we have a community center for a Federal Way, and also there's a senior center. But we're going to look at that to see how we can bring those people together at the community center, or I'm not sure what. The actual senior center is it actually technically is not in Federal Way, or it's, I think, unincorporated, if I'm not mistaken. So it's a little out of the way. It's a good, I visited there. It's a great organization, but I think that's something that's on my mind, you know, people come together and so forth. And I guess the only last thing that kind of relating to me is my wife and I aging in place. You know, how do we continue? How do we keep our people, seniors, you know, we want to stay at our home for the most part. And how can we assist in that from, you know, from a state, from a community point of view? I think that's really important. It's important to me, you know, and I think it's to a lot of people. So those are the things: isolation, the community center, you know, some type of coming together, and then finally, what I'm thinking is about aging in place. What can we do about that?
Yeah, and Kevin, I appreciate you sharing that too. And I meant to say to Kathy that Kevin is one of our other distinguished, one of 10, I think, distinguished members of the newly minted Seniors Advisory Commission. And so I appreciate your service. And I think it is really interesting because a friend of mine and I, we actually went to several different types of senior centers, senior community centers. Around South King County, and if I'm not mistaken, Renton's is pretty phenomenal place, and I think there's is really a huge opportunity for us to come together to kind of look at what other opportunities can we do to bridge the community center and the senior centers together, and what does that look like? So, I'm glad to hear some interest in that conversation as well, and I think when we have Rajiv coming on here, we're gonna find out why we use the word retiree, because there was a very specific reason why I end up using it, even though Hope and Kevin, you're not retired. There is certainly is a reason for that. So I'll take it back to you, Kathy, here.
All right. Well, that's a great segue to Rajiv. Would you like to chime in a little bit and maybe share with us a little bit of your background, your experience, what you specialize in, and how that directly impacts the retiree or senior community?
So thank you, Kathy. So everything that we are talking about, what Hope is talking about, that is a lot of information out there. Very few people really know where to get the information. Kevin, you're talking about age and place. Susan, you're talking about from a more city perspective about all the patchwork of things that happen. How's Melton getting married to Gig Harbor when there are other cities up there? So my background, as you can tell, you could guess, was not born in Waco, Texas, right? So I'm your prototypical foreigner who jumps on the flying carpet, says, I want to go to America. Why? Because the streets of America are paved to gold. That was my journey back in 1982 as a 20-year-old kid who came here, went to college in St. Louis, stayed 7 years there, moved to Seattle, met my wife, and through her I met my father-in-law, who was a quintessential middle-class American. Got a house paid for, got a few $100,000 in the bank. I got my dreams about retirement. Things are going to go wonderful. We'll travel, spend time with friends, family, all the usual stuff that we all think about, age and place, all the things we think about. And none of the dreams materialized in that household because my father-in-law got diagnosed with Alzheimer's the last year of his work life. His wife tried to keep him at home for 6 years. Eventually, when he starts wandering away from the house, she goes to the doctor, and the doctor says he belongs in a nursing home. So they put him in a nursing home. When he gets in the nursing home, another 5, 6, 7 years, all the money runs out. What are we going to do now? Now you got to go on Medicaid. So they go on Medicaid. By the time I met my wife, he was already in a nursing home. And I'd asked her to marry me. She said yes. And we went to Spokane to see her side of the family. And on the way back, he says, I want to stop and say hi to my dad. And at that time, I was not a lawyer. I didn't come to America to be a lawyer. I came to America to work hard, make money, and do the things that we all do. And on the way back, he says, I want to stop and say hi to my dad. And I knew he had Alzheimer's, didn't really know what it was. Knew he lived in a nursing home, didn't have a clue what a nursing home was. And so when you go to the nursing home for the first time, you are jarred into the reality. This is a warehouse of old people. We treat old people a little better than used car parts. It's a collection of people. We put them away conveniently because it's so hard to see it and so hard to deal with all these issues. So then we started looking for lawyers, right? Because my father-in-law, his care was costing the government $5,500 each month to keep him in the nursing home. And I was looking at my wife and saying, my grandparents grew old just like your dad did. Many of them had incapacity issues towards the end of life. Nobody in India is put out of their house to go live in a nursing home. Nobody worries about becoming a burden on loved ones. Nobody is dealing with these issues. And if this is my dad, I can absolutely promise you, and then they will come to live with me at some point in their life, but they will never be in a nursing home. If that's good for them, let's find a way to bring dad back out of the nursing home. So after fighting my mother-in-law, and there's no, we don't want to be a burden. We don't want to be a burden. We finally moved Vivian to come live with us. And I lived right here in Federal Way, a mile from where my office is. This is my stomping ground. And we brought Bill to a nursing home from Spokane to Seattle. My mother-in-law came to live with us. And we tried to find a way to bring Bill back out of the nursing home, including going to Medicaid and saying, how does the system work, trying to understand it. And you can't understand Medicaid. It's not an easy system to understand for anyone to understand. And so my father-in-law dies in a nursing home. I then go back to law school to figure out how does this crazy system work? We pay billions of dollars each year to warehouse these people where they don't want to be. And so my practice then grew out of this love of, or this realization that even though the average American will hope to be able to live out their life in their own home, Kevin, talking to you, your chances that you're going to take your last breath in your own home are 30%. Your chances that you will take your last breath in a hospital house, or a nursing home are 70%. You're hoping not to become a burden on your loved ones. Your chances of becoming a burden on your loved ones is 69%. Your chances that you will not run out of money or you will not spend money on uncovered medical expenses are pitifully low. It is an overwhelming reality that significant amounts of money for the average retiree, whether they are rich, poor, or in between, we end up losing a lot of money to uncovered medical and long-term care expenses. So right from the beginning, when I was setting up my law practice, I didn't have any illusion of becoming a lawyer. My mission was, how does America so routinely and so predictably fail so large a populace? And we got this patchwork of people all over the place. And so for about the first 13 or 14 years I studied, I immersed myself in this, became familiar with the national knowing people like doctors and housing experts and financial planners and clearly lawyers. I was on the board of the National Academy of Law Training only because I wanted to understand where the pieces are. And what you find out is that the failure happens not because people don't plan. We spend a lifetime planning to retire. Think about it. The first day that we get our paycheck, we begin our retirement planning. Why? Because from the first paycheck, what comes out? Social Security and Medicare. What are Social Security and Medicare? Your retirement planning building blocks. We don't even think about it. We're spending a lifetime planning to retire only to have a 30% chance of success in retirement and 70% chance of failure. So after studying this for so many years, here's what it comes down to. The planning that we end up doing is very predictable. We wait for retirement planning. Proper retirement planning is wait till 65, enroll in Medicare, buy a supplement plan, because going into retirement without having access to healthcare is not a good way to plan. So you need to have access to care. Now, what does insurance give you? What does Medicare and supplement give you? They give you access to care after you fall ill. Right? And when you start looking and saying, okay, well, what are the biggest goals people have? The one big thing people don't want to deal with in retirement, don't want to be put into a nursing home against my wishes. And when you define the term nursing home, to me, to this little boy, a nursing home is any place that is not home is a nursing home. Don't make any distinction between rehab centers and nursing homes and care facilities. They're all places of care. There's no magic to any of these places. So the biggest fear is not going to a nursing home. Then you start asking yourself, well, all right, let's ask the question a different way. Who doesn't end up in a nursing home? Healthy people. People who don't fall ill. What is a healthcare system designed to do? Care for you after you fall ill. How does the healthcare system make money? You have cancer and heart attack and stroke and diabetes and cholesterol and also everything that is going to put you into institutional care, make you a burden and take your money away from you is what this system is designed to do. So what can we do to learn from the healthcare system? Is there anything we can do to figure out how to use the system not to fall ill? And then you start going down to University of Minnesota, Johns Hopkins, Yale, Stanford, and you figure out all of these universities have got schools that study aging from a healthcare perspective. And there's this specialty called geriatrics. And anyone in this group, I'll just ask you, how many of you who are above the age of 65 have a board certified geriatric care doctor as your primary care doctor? Where is this education? When we have kids, we take them to see a pediatrician. When we turn 65 and 70, we don't even think about it. And even though Dr. Chad Bolt, a research physician at the University of Minnesota, conclusively through studies proves people who are in the hands of a good board certified geriatric team, you can lower your risk of going to a nursing home or using home care and home health by as much as 40%. You do nothing different. You don't spend a penny more. You don't basically take different medications or pills. You just are in the hands of an expert who understands that the physiology of people over the age of 70 is different than the rest of the population. Medication that is good at 30 and 40 and 50 may be the reason why you're exhibiting signs of dementia at 70 and 80 and 90. And it's chock full of education that is out there, that if you just know how to use the healthcare system a little differently, but don't wait for the healthcare system to give you the information, because their mission is different. And not to say that they're malintended. Nobody in the system is waking up and saying, let's see whose life I can screw up today. We all wake up wanting to do the right thing. But it's not the planning that's the mistake. The mistake is the gaps and the holes that we don't even pay attention to. And when you're a hammer, everything looks like a nail. That's healthcare. Look at housing. And then Kevin, I'm sorry, you opened yourself up, so I'm going to just go pick on you. Please forgive me, and I hope you won't feel insulted, but I want to pick on you a little bit. You have a hope of living your life in your own home, age and place. That's what everyone wants. You got a 30% chance of being able to accomplish that goal. Why? Because your goal is something, your plan around housing goes something like this. By George, I want to live out my life in my own home as long as I can. Because we all know at a gut level, there could come a day that I may not be able to take care of the house. And what is our contingency plan? Oh, we'll figure something out at that time. So the real planning that happens in America on housing is, I want to live my life in my own home as long as I can. When the day comes, I'll end up moving. And let me say this unequivocally to you without any hesitation. That's the worst damn way, the most pathetic way one can approach housing planning. Why? Here's why. Think about what life looks like for the average person the day that we are no longer able to care for ourselves in our own home. Either we have fallen down, broken our hip, either we've had a stroke and we are paralyzed, or at least somewhat compromised in our physical functional abilities, or the fog of memory loss is so thick that living at home, living anywhere, has become very confusing. It probably is one of the worst days in your life. And by having a plan that says, move me when I can't take care of myself at home, you're saying, on my worst day, put me in a place where I don't know anyone. I have zero control over my life. Everyone is telling me what to do. Go ahead. That's the plan that I've got. When you look at it from that perspective, all of a sudden, this makes no sense whatsoever. A better plan is going to be so I can look at my life in such a way so that the day that I fall ill, I have organized everything so that I know with a high degree of confidence that the care will come to me without my children becoming my unpaid caregivers and without me running out of money in the process. It's entirely possible to do that, but we don't look at it differently because the healthcare industry, how does the healthcare industry make money? By selling units, houses, and by selling mortgages and refinancing homes. That's how they make money. So what is the solution to the typical real estate industry is to sell and move you. And there's a whole lot that we end up missing. Then you look at finances. Financial planning is about just having enough money. Isn't the real plan, retirement plan, the real retirement plan in America is just have a lot of money to retire with and go buy a long-term care policy. If you have those two things, everything will be okay. All right, okay, let's see as to whether a long-term care policy by itself can guarantee me I don't ever end up in a nursing home. Give me any policy, any company around the country. Is there any policy that says that you buy our policy, it's a guarantee you don't end up in a nursing home? No, it's not. It's a way to pay for care when your health care is not going to pay for it. So it's more money is what it is. So then what financial planning boils down to is just retire with a lot of money because money will solve all problems. Really, meet Mr. Casey Kasem, $80 million. Where does he die? In Gig Harbor, Washington. Meet Tim Conway, $50 million. Has dementia, ends up in a nursing home, dies in a nursing home. Glenn Campbell has dementia, goes to a nursing home, dies in a nursing home. Peter Falk has dementia, goes to a nursing home, dies in a nursing home. This craziness that if we just have enough money, money will solve itself. There's just that. The real question that we never want to ask are questions that are never even posed to the people. The real question in financial planning is not how much money you have. The real question in financial planning is what assurance do you have the day you fall ill, your children, your people you've named as agents, they will know how to use your money to give you a life which is in keeping with your expectations. Where's that education? When's the last time you had any commercial that pops up that says it's not about money, it's the use of the money? Lawyers, what do? Law school, the teacher, oh, wills, trust, powers of attorney. Let me boil it down to this. Will or trust, who gets what when I die? Power of attorney, who is going to manage my stuff until such time that I die? Living will, how do I want to die? With a traditional estate plan, congratulations, you're ready to die. Look at the life and say, what do I really want to accomplish? I don't want to be in a nursing home. I don't want to be a burden. I want to protect my money. These are ships that pass each other in the ocean. They're never going to connect.
Did I say, let me interrupt one moment. Did I see Susan, did you want to chime in?
Yeah, I'd like to ask a question. I appreciate the comments, and they're very, very important for people to know. But I look at it on an economic level, because not everyone owns a home. Not everyone can afford long-term care insurance. We have people on the margin and below the margin, but it's a cultural thing as well. We in America do not have the culture to take care of our elders. It is a cultural thing. Let's just put them away. Let's put them in an adult home. We don't have the ability to do it. And in a family situation, because the dynamic in our culture isn't there as it is in other countries around the world. It's not an easy thing when somebody has Alzheimer's or somebody is peeing in the corner, which what has happened. It's extremely stressful for families that have children. With people who have a home, the planning, I agree, is let's get somebody to come in and let them be in the home. You know, if the parents, the aging in place, I want to age in place. I'm retired from PLU. I retired at 71 and I'm doing my city stuff. But I want to age. I know that my property, as I get older and my husband gets older, can we really do that? Can we really manage the yard? Do we have enough money? We might have enough for X amount of years, but there's so many out there that don't. They're living in apartments with families. You know, what do we do with the masses of people that can't afford the stuff, that all they have is Medicare, and it's robbed from people all the time? Not meaning the government is taking it and using the monies that they've paid in their whole life for retirement, because it's no longer in the dedicated fund for Social Security. That's the maddening thing as well. They were relying on that. And now they want to, you know, there's people that are hurting.
Right.
I'm middle class. There are people that aren't middle class. So how are we helping them?
And those are great questions. Rajiv, what recommendations would you have for you know, your average family, but also your families that are kind of struggling and trying to figure out putting these pieces together? What are some steps that they can take? I know you just mentioned a few of them a few minutes ago, but maybe you can reiterate some of that to, you know, what can we do?
And Kathy, if I may, Rajiv, sorry. After that, I definitely want to hear from Jerry,
Yes.
who's been waiting so patiently. It's good to have you here. But Rajiv,
We haven't forgotten you, Jerry.
yes, we haven't forgotten about you. But I'll kick it back to you, Rajiv, to answer that question. I just wanted to make sure we got Jerry in here as well, part of this
Sure.
conversation.
Let me just give you a short answer to that one, right? I don't think that I have that easy an answer for you, but the first thing that I'll say is when I started my PhD, I was sitting in a class, there's 7 students in the program at UW. 2 of us were from the States, everywhere else was from overseas. And the first day of class, you basically say, what's your thesis? What are you going to be studying? And I said, I want to find a way, how come most people in America never want to end up in a nursing home, become a burden, or run out of money, but we got a 70% chance of doing that. So sure enough, I mean, I catch people's attention. And so the professor, after I was done with that, she says, can I talk to you after everyone has left? Hey, sure. He says, why do you think that you're going to be able to shake this paradigm that we have in America? Susan, exactly what you were talking about. And my answer to her was, I'm not here to change the paradigm. I'm here to change that one person who is sitting in front of me. I can't really come up with the resources that it takes for the person who doesn't have a lot of wealth. But for the people who don't have wealth, let me say this, there's a 3 times bigger population of people who are in the middle class. They're not rich, they're not poor, they're in the middle. Because those are the people that I worry. My father-in-law was not poor. There was no reason to think that with a couple of $300,000-$400,000 in the bank and with a house that was paid for, that he would ever have to be destitute on the doors of Medicaid. So those are not my program is not designed to solve all the world's ills. My program is to challenge the government and say, when you sit down and create programs that say, when somebody has Alzheimer's, we will pay for that man to be in the nursing home, you have destroyed the fabric of the family, because in the end, you were never the family. You can never come up with the answer. You give half that amount of money to the family and say, I don't know what you're going to do, but here's a social worker who will give you different ways you can approach life. If you want to keep your dad at home, this is what it looks like. If you want to take him to an adult family home, this is what it looks like. If you want to take him to a nursing home, this is what it looks like. It should be the family making the decision, not the government. We spend 3 times the amount of money to give horrible outcomes to people because we don't look at it differently. And Susan, the challenge that I have, if I was not born in India, there is no way I could look at this issue. And that's a big challenge to me. Because you are not born in India. You're born in this culture and saying, this is what we embrace. This is the way we grow. And my only answer come back to you is, I can't solve it. If you want to go and look at the same problem differently, which is what America does best, we put people on Mars, not because the rocket could take us to moon and we couldn't figure out how to go to Mars. We went to moon, now we want to go to Mars. We look at the same problem differently. We have to open our eyes and say, if 4/5 of the world's population can live retirement in a very different environment, what are we missing? What can we learn from them? That opening and awakening is the beginning. And my answers are not for everyone. But I can tell you this, that people who do embrace the answers, they have an 80% chance of their life turning out the way they want to, because most middle-class Americans have enough money and enough resources to make a much better outcome.
Thank you, Rajiv. And that's a really good point. So kind of, if I can summarize a little bit, kind of what you're saying is that we as a community, society, and even in governance need to reevaluate our structure and our system a little bit and kind of take a few lessons, and then maybe we need to apply some pressure to help create a system that better reflects what we value and the outcome that we're looking for. Is that kind of
I think in the government, the challenge that Councilman Member Moore is going to have, that the politicians have, is that money rules. You know, everything that I'm talking about, it takes money away from businesses. Right. Guess who's not going to support these solutions for the most part? Are businesses. So someone's got to have a grit of steel to go ahead and say, we need to do the right thing, not just go ahead and pander to where the money is.
Absolutely. That's great.
Which is what I like about Michael. You know, he comes to my office every now and then, or I'll walk into his office and give him the riot act. What the hell are we doing building these buildings up here? Not one of these people is going to ever come and use my services here. You surrounded the mall with 3 low-income housing places. You may as well take Federal Way and call it whatever you want to call it. It's not the direction that we should have a mix of it, not the exclusivity of the whole thing.
Absolutely. Thank you. Thank you very much for sharing, and we appreciate your perspective, and certainly you're a great resource as well for issues pertaining to elder care, and so we appreciate you joining us. And Jerry, we see you there in the shadow a little bit. So thank you so much, and we know, Jerry, your family has been very involved in the Federal Way community for a long time. And as the years have gone by, you know, and you are now able to give us a perspective on perhaps what the senior portion of our community might be experiencing. What are some perspectives that you have, or some things that you have seen as far as unique challenges, particularly to the senior community, and what is some feedback that you can provide us, and maybe even that Olympia needs to hear as well?
Well, I've known Rajiv a long time, and I kind of would concur with a lot of his comments. I have a different background. I was born in Seattle, but when I was about 5 days old, when I guess out of the hospital, I came to Federal Way. And back then, it wasn't even called Federal Way. It wasn't Federal Way till the 50s. Except for the school district. So I've been here 73 years, and I've been retired from a full-time job for 25 years. So I have an experience dealing with retirement, but I've been keeping busy. And I guess one of my observations is over time is it's not as much the money you have as the relationships you have. And that, saving up for retirement and have a lot of money, if you don't have relationships, and it's relationships, I've been involved with a church. I have a faith, but I have family and I have friends, and that's what keeps me going. It's not having a big bankroll, because I've seen a lot of people over, I was a CPA for 50 years, and so I've seen a lot of people have money, and I've seen rich people be real miserable, and I've seen poor people be quite happy. And so it isn't, if you think money's going to make you happy, it's not going to do it. And I think an important thing is for people to take responsibility for planning, not just wait. And then, because I have a lot of friends, and they're getting I have friends from high school that are my best friends, and now they're getting dementia. And it's hard to deal with that. But they're my best man at my wedding, high school buddies. I have guys I was in kindergarten with, that kind of stuff. It's really difficult. And so I started thinking about that, and I wanted to keep active myself. So I stayed involved with some physical activities. I play golf, and I've been exercising a little more than I used to, and try to take care of myself as best I can. Also exercise my brain. I think you got to stay active. You can't just sit sitting around waiting for old age to happen, because it's all going to happen. And so I think those are really important. And I can't solve everybody's problems, but I talk to my friends a lot about things, and convince them that, hey, you got to get out of here. I had a beautiful home, but it had 3 levels, and I wanted to stay there till I was 75. But a few years ago, I said, maybe it's time to start thinking. So I sold the house, moved into a senior community, 1 level, 2 little steps out of the garage, downsized. And I know Hope mentioned about, people selling things. Well, most of my friends can't give their stuff away. The kids don't want it. That's the biggest problem. It's just, what are you going to do with all this stuff? And so mentally, you got to start planning on getting rid of stuff, because the kids don't want. You got this beautiful china and crystal. You go up to Fusion. I was up to Fusion last week with my sister's downsizing, and she's got all this china, and I went up there and they got china all over the place. So we don't want any china. You got a beautiful set of Lenox china. You can't even give it away. I mean, it's really kind of sad to do that, but people get hung up on things instead of relationships. And if you have friends and family and worry about that and take care of the relationships, the money, the money is not that important. It's the relationships. People get it. I listened to a program years ago, the Big Switch. People use resources, uses the relationships to get money, and it should be using your money to develop relationships. It's just the opposite. And that's how kind of I look at it. I don't think the government's going to solve the problem. I think they might be able to help, but it's really community groups. I get like the senior center, churches, and if people just focusing on the money side of things, it's not going to work. So that's kind of my observation, and I've been focused. I have wonderful parents, and I have brothers and sisters, and one sister, and they focused on the family, and so I have cousins, and I have nieces and nephews, and we all get along really well. And so I got 2 boys, and they were raised, and now they're married. I got grandkids, and they're close by. So that's what matters to me. Not, gee, I got a big house and I go down to Arizona for the summer, for the winter. I like to stay at home. I like Federal Way's my home, and it's relationships, not the money. But you got to plan. You can't just assume money's going to take care of you, because that's the least important thing. I mean, it's important to have enough, but it's not how much you have, it's how much you spend. And a lot of people spend their money a little foolishly. So you got to be a prudent
Yeah,
person.
that's
my
that's
observation.
great, Jerry. And kind of what I'm seeing too as or I'm hearing as a theme is obviously, yes, there's the financial issues and need, but really it's a full spectrum type of a challenge. And so everyone has kind of touched on, the isolation or, lack of social or emotional support. And so kind of what I'm hearing is let's make sure that that is just as much, if not more, of a part of the equation than the financial component, and perhaps part of the role of government and even community is to help make sure that we're supporting that as much as we can and that we're driving things in that direction. That's kind of what I took from it. What Martin, are your thoughts on that?
Well, Kathy, you said the same thing I was going to say.
Feel your thoughts.
No, it's interesting to kind of just sit back. I mean, I'm doing a lot of listening on purpose, because I think politicians talk way too much. But I think, when we talk about how has COVID impacted our retiree community, it's really has made a lot of our retirees Rajiv, seniors, isolated is a big concern is what I'm kind of hearing. And I think the other thing I'm hearing, just like what you just said, Jerry, which is relationships. Relationships are absolutely important. And what I'm also hearing is I like how you said that, Kathy, the social and emotional type aspect to this. That's a big deal. And I think we always hear that with our kids, but really it's our retiree community as well. And so and kind of what I'm hearing Susan, Councilmember Johnson, saying is the affordability aspect, how realistic is, and making sure that we're making it work for people. And gosh, as the youngest person here, oh nope, Maylene, that's Maylene. It really is quite fascinating to hear Rajiv, who by now you guys know that he's an expert in this field, is that you don't have to have money to have a good retirement, if I'm not mistaken, right, Rajiv?
It is not money. I think we mistake money. I think Jerry is absolutely right. Spot on that one.
Exactly.
We are a capitalistic society. Everything is about geared towards money. But in the end, we all know it. We all know it. It's not money.
Right. So I guess, so that's what I'm kind of hearing. So obviously, my goal is to listen, to bring, hopefully get elected and to take those issues to Olympia. So what is it that you think is important for a representative to be focusing on when it comes to retiree issues? I mean, what are the issues that are important again?
Hey, Martin, I'll get back to you. I have something to go to, so I have to apologize and bug out of here. So nice meeting you there. I'll be in touch with you then.
Okay, good. Say hi to Maggie for me. Thanks.
All right.
Thanks,
Take care.
Kevin.
Okay. So
on the government part of it, if I may, I think my biggest hope would be that, look, I mean, legislators can only act on what they know about what life is about, right? I mean, they have to experience it. Their experiences, their upbringing, their morals, their own. That's what guides people to take action. And at this point in time, from this professional's perspective, I think we have a deficit in retirement planning, proper education. There's a lot of education about how to do things that make somebody money. But how does the consumer pull all these pieces together? That's missing. So I think at the government level, I sure would love to go ahead and see the government says, okay, well, what are the different ways? Like you have the commission up there, right? In Federal Way, we have Hope, we have the commission. And I had suggested to you that at some point in time, we need to go ahead and say, well, Federal Way needs to go ahead and bring in a retirement fair. But we bring in every constituency, everyone who's making money, not making money, we put there. But the education has to be an honest education. 3 years, every 4 years, I've been doing this thing, right? I bring up national conference and I pull it together. Every 4 years, I do that. It takes a lot of effort to go ahead and pull it together. But there's nothing being sold there, not a damn thing being sold. It's all about education. that's what's missing. And that's what I think Olympia needs to do. Sorry, Susan, you were.
Susan, Councilmember?
Thank you. Thank you. I agree with that. Education's important. Well, another aspect is in tight budget times, especially after COVID for next year, is how is the government going to continue efficiently doing the services that are needed for elders? And one aspect is, how do you get rid of duplicate services that are being minimal versus if you coordinated to a unified body, it would be more cost efficient, because we duplicate services all the time.
Yep.
Counties don't work with other counties. Everybody's got to do their own thing. It's like, how do you bring, it's what's happening all in our country right now, is how do you bring people together in a way to save money but still provide services and not duplicate? And that is, for instance, being able to stay in a home. There should be more laws that really make it easier to train people to come into a home and help a senior stay, to help the family stay. Our gearing in this country is just put us out in the retirement place where you can get MRSA, and you could be abused by the caretaker, by the person that's hired that doesn't want to be there, but that's the only job they can get because they're from another country, or they have no money, education, but they can get that license to go into a retirement home. It's coordination and cut the duplication. And again, it's that's basically it. We've got to cut the duplication and use the money as efficiently as we can to reach out as far as we can after COVID, because next year budget's going to be tight.
Yeah.
Very tight. It'll be 2 years down the road. I don't, maybe that's my viewpoint, because businesses are down.
Yeah.
People are still out of work.
Yep.
So how is the legislature going to deal with it?
Yeah.
The elders, and not put the elders out on the back, because their voices aren't always heard loud enough.
Right.
And our United States way of saying, you've done your thing, just go out to the farm.
Well, I think that's why, you know, Rajiv knows this actually pretty darn. Rajiv and Kathy know this pretty well, and that's, you know, I mean, it was several years ago where I just kept saying, "Gosh, we're not doing enough for our seniors in Federal Way, at least." And Kathy knows this, but when she worked for the mayor, I always would just, God, we would talk for 30 to 45 an hour, you know, and that was her lunch break. No, I'm kidding. That was not. But we would,
after hours when we were still there working.
No. So we would talk about these issues, and I remember with Rajiv, you know, it's like I was a member of the Parks and Human Services and Public Safety Committee on the City Council, and I would just continuously talk about how we need to add a new commission. It's time to add a new commission. And I actually took it on the road and talked to many people. And so that being said, I brought in Rajiv to kind of help make the case, because the public can come to our committees and make the case. And it just kind of, quite frankly, and I humbly say this, it fell on deaf ears, right, Rajiv? Remember that?
Yeah, I do, yeah.
Yeah,
no, it's okay. It's a different thing. And again, you know, I think Susan said it best, that, you know, we have a way of doing things. It takes time to go ahead and overcome that, but you keep chipping away at that, right?
That's exactly it. That's exactly it. And now, very pleased to have the commission. And again, I think, you know, and I did visit a number of retirement centers as well. And I'll tell you what, Councilor Johnson, you are 100% right. That I think, you know, one of my takeaways rather was that our seniors felt like they're not being heard.
Mm-hmm.
Not being heard. And I think that's really the purpose of why I wanted to kind of do this. And I hope to do many more of these type of things. But it's like our seniors' voices are just so important. And again, not to pick on you, Councilor Johnson, which I'm sure you're not used to it, but
Jump in real quick. That's true, because they often don't, when it comes to voting, they often don't let all the candidates come in, so that they still vote. They're still eligible to vote in the senior centers, and they're not providing the opportunity for the seniors to hear the candidates all the time.
well, and a lot of them want to come to council meetings too, by the way.
Yes.
And there's no transportation.
Nope. Not in our city.
And I am proud. I mean, I really am, because our city budget the mayor just unveiled his, unrolled. Is that even a word?
Rolled out.
Unveiled. I guess English is a second language for those that are listening for me. But the mayor just unveiled his budget, and I'm impressed. I mean, every department heads, are presenting. And the Parks Department has done a phenomenal job, and hope you may know this yourself, but they've done a phenomenal job in really serving our senior population from the recreational perspective. And we've actually added, it's my understanding that we've added a third shift for the Hyde shuttle to come through. Is that enough? No, it's not, but it is definitely a step in the right direction. And it takes a lot of coordination and relationships to really get that to come through. So there's just, connection to services obviously is one. And I really do appreciate, what I'm hearing. And that's, that I'm really interested, Susan, I'm going to talk to you again about this offline, the duplication of services and how other counties may have the same thing. Why not streamline it and make sure we're being efficient? And that's kind of, not to get on the campaign bully pulpit here, but it's just, every dollar that goes into government is so valuable, and everybody here I think knows that. And how do we do the most we possibly can? I mean, my campaign, my opponents raised $120,000 and I've only raised $55,000. And how do I do the most with my budget to get the best outcomes? And so, and that's what this is. How do we do the most and simplify and streamline everything throughout the state of Washington is one thing I'm kind of hearing when it comes to connections and services and whatnot. And the other one, and I appreciate this because my mom and my father, my father is fighting, is fighting Parkinson's. And while he wasn't diagnosed with this, but he has dementia-like behaviors. So the question was, do we put him in a home? Or do we buy a home, a one-story home here? And let me tell you how hard it is to find. We almost went into Milton, Susan. And so that being said, it's, it is hard to find a Rambler. It is hard to find Ramblers. So I think that's something that needs to be noted,
Why don't cities zone for areas for seniors for the small homes? They do it for other ways. Why is it that it always has to be a big building or something? Why aren't there areas other than profitable retirement places?
Yep.
And that's a good point too, if I can chime in, is that other populations other than seniors could benefit from that as well. Because what if there's a person that's experiencing a physical difficulty where stairs are a problem, right? So there's a lot of people that could benefit from that sort of thing. That's an interesting point.
And it's both seniors and young people, small homes. We need small homes.
Yeah, exactly. And I think, so obviously my mom and I both found one home in unincorporated King County. Luckily for them, they can still vote. I think they're going to vote for me. But I'm not really sure. So again, it's a story of my mom wanted to keep as many things as normal as possible. And we have an amazing, phenomenal caretaker from Comfort Keepers, which I'm sure you've heard of them. But she does a magnificent job. And I cannot tell you how many times my dad and her are laughing are laughing, and it just brings joy to my heart, and it brings a peace of mind to my mom. And I think that's the system that we're needing to look at, and what I'm kind of getting as my takeaway, and something that we should be focused on in Olympia, is how do we incentivize through tax breaks more senior developments that are homes that are focused on working with stakeholders to get trainers to be more like Comfort Keepers and others like it, to keep seniors in their home fronts. So that's what I'm kind of hearing so far. Hope, you've been quiet for a really long time. You know, I used to be a substitute teacher, and I would always call on the students that were quiet.
Well, my thought was, Martin, maybe Hope could share with us how people could get involved in the senior commission, if they want to just attend and hear what's going on, or if they'd like to be a part. How do they find that information?
We do have a website, and but there is the least thing was a 2-year appointment, and I'm one of those, so I have another year to serve. You can't, but public is always welcome to observe, and I think that's a really good move to do, because you find out there are so many things going on in this city, but you got to find out what really pleases you. What do you really get excited about going to a meeting, not just a meeting to go to a meeting? And so I think that that's probably one of the best things anybody can do. And you know, I will say one thing too, is that I think the people, as a general rule, say the churches should do this. If you really knew how much money the churches in Federal Way give every year, the amount is staggering. It really is. How much food they give, how many meals they provide, how much they do. And, you know, they can't afford to do this either. They haven't had church services. The tithing is down, and everybody's hurting, not just the businesses. Our churches do too. And I'm a member of the caregivers, and we put on 3 meals, or we did until 2 weeks ago, put on 3 meals a week for the homeless. I've been one of them for 25 years. I've done this. And there's only so much money. And if you don't get the donations, you can't push it on. You just can't. And you stop and think of all the good organizations there are in this town. And a lot of us know that the end is near for a lot of them, because they just can't keep doing with no money.
I think kind of what Councilmember Johnson was saying too, COVID itself has been a challenging time, but I think we're going to be in for, I don't know if even more challenging, but it's certainly challenging in a different way as time goes on, as some of these businesses are going away, some organizations are having to fold, you know, government funds are going to be tight. And so I think, like she said, eliminating duplicity and looking for ways to be efficient and to partner even better is going to be a even greater challenge and a greater need going forward. So absolutely, those are great points. Thank you.
Well, good.
All right. Yeah. Anything else anyone would like to chime in or add?
Thank you for doing this.
Yeah.
Absolutely.
Thank you, Kathy and Martin. Really, yeah, this is good work.
Rajiv, maybe I'll get you to come to Milton and talk to our mayor.
I'd love to. I mean, I'm there anywhere. I mean, the good news is the work that I do, it finally got picked up by PBS.
There you go.
I've been at it for years and years and years. And so we just did taping. And so hopefully by next year, we should have it.
That's exciting.
To air, so, yeah.
And Rajiv, remind us what your website is as well, because I think it's a great place for resources and to learn more about what you do.
Oh, thank you. Agingoptions.com.
Agingoptions.com.
Great. And Hope, I think if people go to the cityoffederalway.com website and they look under commissions, I think they can probably find the date and time of the meetings. They can find minutes and agendas and all of that as well. Is that right?
That's very true. And the good thing is that the senior commission meets at 2 o'clock in the afternoon. so you don't have to go out in the rain and the dark.
Nice.
Because, you know, that's a danger for most older people. So, yeah, so 2 o'clock on a Wednesday afternoon isn't too bad of a time.
Great. Thank you. Oh, Martin's got something there. What do you have?
So this, we were
brochure.
yeah, exactly. So we were talking earlier, and that's these commissioners are phenomenal, but they've created a little booklet of resources for our senior community, and it's you know just has all sorts of really just resources in terms of health insurance, in terms of hospitals, in-home care, legal assistance, and
It's online also.
Yep.
That's what I was going to ask, if it's been
I'm
turned into a
looking
PDF and uploaded. Great.
Yeah. I'm looking at it right now.
Great.
gosh, Hope, as a commissioner, we need. I wonder. We should add Rajiv's information in this little resource too. So we'll have to work on that when we update it again. But so it's a great little resource, and I was holding this up because it meets on Wednesday, as Hope just indicated, at 2 p.m. So good time. Not a good time for me to meet. I work during that time. But just a huge thanks to everybody, and Kevin King for joining us as well. For Milton Councilmember Susan Johnson, Jerry Knutzen, Hope Elder, and Rajiv, thank you for joining us. Really appreciate it a lot. You know, this conversation needs to kind of keep going, quite frankly. It's an hour is far too short of a time to be discussing this, but you know, I've appreciated the comments and the discussions, the wisdom that Rajiv, that you have, and everybody else's experience as well. And I am hopeful, and you know, that I'll get elected to the State House of Representatives to represent the 30th district. And Susan remembers me when I worked for Roger Freeman, so I've got that experience, and many of you guys will as well. But I know what to expect and what's coming at me, and so really important, pivotal time for the state of Washington, quite frankly. And so let's continue this. I hope to have this again in a couple of months, perhaps. Maybe on December 25th would be another good time to have it. Never mind. Sorry, that's great. Of course, we don't want to have this conversation on Christmas. But anyway, so I just want to say thank you from the bottom of my heart. A lot of work needs to take place, and again, I really appreciated the words that our seniors and our retiree communities have worked incredibly hard all their life. They're engaged in our community service organizations. They're engaged in our church organizations. They're engaged in all sorts of capacities, making our community stronger. And as a 36-year-old person, I stand ready to be their voice, to be your voice, to learn, and to be an advocate for our senior citizens, just like I have as a council member, and I plan to continue doing so as a state representative. So, Kathy, shout out to you. Thank you for joining us. You did a great job of asking questions. I didn't want to be the one that does that. I wanted to listen. I think it's really important. And Maylene, thank you for facilitating this effort as well. I really appreciate it. So with that, I know that we're on time budgets, and it is 7:27. So with that, we will end it there. So thank you.
Thank you. Bye.
Thank you guys. Stay safe.
Goodbye.
Bye-bye.
Bye.